second here to. Okay, so our next presenter is Erin Schmitt. And Erin is going to be presenting on expanding specialty care access in rural Libby, Montana with virtual health services. And Erin's site mentor is Mandy Picorni, who is the virtual health manager at Logan Health. So thank you both for joining us, and I'll let you share your screen, Erin, now, and take it away.
Can you guys hear me okay?
Yep.
Okay, good. All right, let me get to the screen share here. All right, and here we go. Okay, can everybody see that all right? Get to the beginning. Okay.
That's good.
So I really talked about my presentation is expanding specialty care access in rural Libby, Montana with virtual health services. So I'm going to kind of go into that a little bit more here. So the objectives, we want to learn about Logan Health, its coverage area, and implementation of health services. We're going to review the current state of telehealth at Logan Health, and we're going to determine the number of patients in the Libby, Montana zip code for the surgical service lines at Logan Health. We're going to develop practice-specific presentations, and we're going to review the presentation that I actually did give, and we're going to review the survey results. So a little bit of background here. Logan Healthcare is a healthcare system located in Northwest Montana. It serves the greater Flathead Valley, namely Whitefish, Big Fork, Kalispell, and Columbia Falls, and the outlying areas. It captures a population of over 175,000, and its geographic coverage area is about 20,000 square miles. Since 2014, Logan Health has developed its virtual healthcare offerings, and it includes both acute telehealth services and ambulatory telehealth services. So the current state of virtual health at Logan Health is, we've got two sides of this. We've got the acute telehealth services that averages about 10 to 20 calls a month. It includes telestroke, teleneonatal, and telepediatrics. So those are more an acute setting. And then we've got the ambulatory telehealth services, which you can see is a lot broader, with an average of 2,500 visits a month. Its facility, there's two ways that it can be utilized. It's facility-based, which means the patient is located in a clinical building and is connected to the provider at the provider's location, or it's direct to patient. So the patient is at home and the provider is in their clinic, and they connect electronically that way. So Mandy and I worked on gathering data to determine the need in outlying areas. So while the majority of patients are in the greater Flathead Valley, the patients in rural communities also need services as well. So facility-based telehealth services can support expansion of creating regional clinics with virtual access to specialists in outlying areas. So the goal was to kind of look at Libby specifically and say, how many patients are currently utilizing digestive health, surgical, and urology services, and be able to use that to show these services you can use telehealth to reach your patients. So we went over, Mandy and I did a lunch and learn where we presented this to the surgical service lines at Logan Health. So we've got gastroenterology, urology, and oh shoot, now I just had gastroenterology, surgical, as well as urology. Apologize for that. And so we presented this to those clinics to show how they can reach more patients. And so why does this matter? Why do we need to have more access for patients? Because zip code alone can affect life expectancy by 30 years. You know, that sounds like, you know, you kind of wonder, is that just people in different parts of Montana? Is that people, you know, comparing a zip code to somebody who lives in Uganda to somebody who lives in New York City? Where does that 30 years come from? Well, the interesting part is that a study was done in Chicago, and it showed a 30-year difference in life expectancy between the affluent community on the north side and the poor African community on the south side of Chicago. These regions were only separated by 9 miles, but the differences included basic social services, education, clean water, safe streets, and access to healthcare. So the social determinants of health are the conditions and the environments where people are born, they live, they learn, they play, they worship, and age. And this can affect a wide variety of their health, their functioning, and quality of life. So you can see the social determinants of health there. And we're specifically going to talk about healthcare access and quality. And that can be improved with telehealth. So this is just kind of an overview of telemedicine services at Logan Health. First, you've got home-based services. So the patient's located at home and the provider is located at their office. We've got on the far right, community-based services. So direct from the provider to the school, provider to an employee clinic. And then what we're really focusing on is the facility-based telemedicine. So ambulatory, namely, so this would be the patient, it comes to a clinic where there's equipment to connect via telemedicine. And so that would be in Libby. Here we have a specialty care office. The patient would come into the ambulatory clinic and be connected with the doctor. In our case, it's typically 90 miles away in Kalispell. So here's an example of the area that Logan Health serves. We've got Libby up here in the upper corner of Montana. So the green circles are the areas that have ambulatory telehealth. So the green circles are the ones we're going to focus on, and namely, we're going to talk about Libby. So we have some lingo that we use in the telemedicine world. The hub site, you can see here, this big L, that's where the provider is. Typically that's in Kalispell at their office. It could be urology, it could be cardiology. Basically any of the services can utilize this. And then there's the spoke sites. So the spoke sites are really the place where the patient is. And in Libby, that's going to be the Logan's Health Specialty Care. So this was, I showed this demographic earlier. So we basically picked 2 populations just for comparison. Eureka and Libby utilized some data collection, and there was a team at Logan Health that helped with this. And the count was to determine how many patients are already utilizing digestive health services, the surgical clinic, and urology. So, we've happened to pick these 2 zip codes. Really, Libby serves far more than that because we have Troy, Knoxon, Trout Creek. There's also Erin. Some people even come from Thompson Falls. We even cross over to the Idaho border, like Bonnersberry and Moyer Springs. So this is very much underrepresentative of the patients that are likely already utilizing services. So this is the Libby Specialty Care team. So these are my coworkers, and we've got Kristen, she's a medical assistant. She's specific to telemedicine. She was hired just for that purpose. We've got Jessica, she's their front office check-in person. There's myself, I'm a certified medical assistant. And we've got Susan, who is our registered nurse on site. So this was to kind of present to the other offices and say, hey, this is our team and we're here to help you. So then we need to kind of think about who lives out of the valley, who has limited digital proficiency, who could benefit from having a telepresenter, get vital signs, get a height and weight. What type of patients and appointments tend to cancel or no show? So, sometimes these are patients that maybe they just need to check in with the doctor and get a result, and they don't want to drive 90 miles to Kalispell. We have a lot of patients that are hematology oncology patients who are seen very, very regularly, and maybe they go to Kalispell for their first visit, but the other visits, they're able to come into our office. We're able to get vital signs, make sure they're not losing weight, make sure their blood pressure and other vitals look good. And then we're able to connect that patient. And then if the doctor decides, hey, I need to get a CBC or I want a urinalysis, we can collect that on site. And it tends to reduce the number of patients that are not showing because maybe distance is too much for them to travel. And then the other, a lot of times I think of our elderly patients, they don't have a smartphone. They're overwhelmed by technology, or maybe they don't even have access to internet. So those are patients that we can help kind of bridge the access gap. So this is the patient experience. This is the clinic that I work in. There's the Logan Health. We've got a cardiology and pulmonology clinic that's in there full time, and then the Logan Health specialty care. So part of my presentation with Mandy was to actually walk through the clinic. I went outside the building. We walked through the commons area, walked into the clinic, and just gave a path and showed these other facilities how the patient is moved through the clinic during a virtual health visit. So this is an example of the service line rollout. So basically Logan Health as a whole is working on utilizing telemedicine more and more. So hopefully starting beginning of June, urology, surgery, and digestive health will be on board to get this going. And then they have plans later on to do additional services. So I did a little survey. We started off with, basically how often do you use telemedicine and how comfortable do you feel with telemedicine? And so there was the pre-test portion, and then we asked that same question post-test, and then the likelihood that these healthcare providers would be willing to promote it to their patients. So we found that, the people that we were talking to, about a third of them rarely used telemedicine and 2/3 never had used it. So the comfort level was pretty low, with basically a little over a third being somewhat comfortable and almost that much being very uncomfortable. So the goal was to kind of educate the other healthcare providers and say, this is what we do, this is why we do it, this is why it's a viable option for your patients. And then afterwards, it was like, how often do you feel comfortable? And after the presentation, 100% of those attending said that they felt somewhat comfortable with the process. So the last question was, how likely are you to promote clinic-to-clinic telehealth? And 100% of them said that they were likely to promote telemedicine to their patients. So, there's some practical lessons learned, and this will only grow with time and as this program gets rolled out more and more. Telemedicine is not for everyone. Some of the doctors are going to absolutely love it and say, oh yeah, sign me up. And then there's other ones who don't want to have anything to do with it. Some of the patients love it. Otherwise, I've had some patients that say, oh, I'm not talking to the doctor on a computer. So, some are going to like it and some aren't. We're not going to get everyone to be on board, and that's okay. But we do know that healthcare is a social determinant of health and how we access that. So improving access is not only, it not only improves the quality of one's life, but it improves the life expectancy, as we saw earlier. Our job as healthcare providers is to meet patients where they are, and that includes utilizing technology to help bridge those gaps. Is it perfect? No. But is it a viable option that increases access for patients? Absolutely. And then I just wanted to say thank you to Trisha and Lee, who are faculty at University of Montana. And then Mandy Picorni, she is the self-proclaimed data geek who was more than happy to help me gather this information and has been really a great mentor. And then I have additional references if anybody has questions and wants to look something else up. And then that concludes my presentation.
Thanks, Erin. Does anybody have any questions for Erin about her project?
Erin, how many, when you went to do this training, how many were there?
It was limited, and so there were at least, I would say at least 10 at each telemedicine presentation. That being said, one camera and one login was used for example, gastroenterology, and we didn't know how many staff were actually sitting in the room. So we were a little bit limited as far as the number specifically that we were reaching.
Thanks. Any other questions for Erin? Okay. Well, we'll stay on time here. So
I think
thank
there
you,
was one more
Erin.
in the chat.
Oh, I'm sorry. Oh. Okay, so Erin, this is from Meg Tracy. Did you learn anything about accessibility barriers or supports for people with disabilities from your project? Oh, that's a great question.
You know what? That is a really great question. That's not something that we took into consideration, but it certainly, should be on board for, another presentation, and maybe reaching out to the facilities and saying, hey, what barriers do you foresee supporting that need to be supported? So, that's not something we did look into, but it certainly would be a great idea for later.
Yeah, great. Thanks, Meg. Good question. All right, thank you. Thanks, Erin. Thanks, Mandy. Good to see you guys. Okay, so we'll stop recording.